I'm Josh Rabinowitz. I'm professor of chemistry and integrative genomics at Princeton University and the founding director of the Ludwig Princeton Branch. The branch kicked off at the very beginning of 2021, just as we were coming out of the COVID pandemic. Today, we're here on the site at Princeton University in the ICON laboratory. The theme of the Ludwig Princeton Branch is understanding the connections between diet, metabolism, and cancer. Ultimately, we want to unravel how what we eat affects how metabolism works in our body and how that determines the risk for getting cancer and the outcomes of cancer treatment. We know that what we eat is one of the major determinants of our long-term health and whether the immune system has the power to fight off any cancer that we may get. Whenever I talk to patients, they're frustrated that they can't get better dietary recommendations, and I think we need to be able to offer that to them. Ludwig Cancer Research is a really special organization. They're about the most distinguished set of scientists you could dream of working with. They're so creative, so open-minded, and so eager to collaborate and work together to tackle this terrible problem of human cancer. As founding director of the Ludwig Princeton Branch, my goal is to focus our efforts on understanding metabolism, building the biological understanding required to practically impact the cancer problem and help patients' lives. We're only 3 years into the journey of the branch, and we're already making scientific progress. We have big discoveries about how much energy cancer needs, and it needs less than a lot of people would have thought, less than most normal tissues of the body, in fact. We have practical discoveries. We have lead compounds that are showing activity in enhancing immunotherapy in mice. Beyond that, we're building an ecosystem of scientists who are working together very productively to tackle this problem. Diet is super complicated. The number of chemical constituents in everything we eat is astounding, and it's not easy to decipher how those chemicals entering the body influences downstream disease. We still don't know all the chemicals in what we eat or all the small molecule chemicals, the metabolites in our bodies. I think one of the most exciting opportunities is discovering new metabolites that shape how our bodies works. We also know that one of the biggest opportunities to attack cancer via metabolism is by enhancing the immune system's ability to fight cancer. These, I think, are not just very fundamental scientific discoveries, but things that people can immediately extrapolate to their own dietary choices. My aspiration for the branch is that in 10, 15 years, we're able to look back and say, we can now give rational guidance to patients about what to eat or what not to eat when they have cancer. Even better if we could also make concrete recommendations about food choices that would impact the risk of cancer.